most important, I feel, an interesting question I would like to ask my colleague here, the myths and the facts related to the patient, the pre-operative,
Right.
post-operative, and also the whole gamut of their healing. What are the myths? What have you heard? All the kinds.
So many patients come and they ask whether it's going to be painful.
Yeah.
Right. So, and the last 15 years that I've been doing LASIK, I don't think I've come across anybody who after LASIK said it was painful.
Yeah.
Right? But most of them are so afraid of getting under the knife, under the
What
table.
do you feel is the reason for that? If I have to say, I could be completely this out of the box, but
Right.
I feel it's the first time that the patient is undergoing a surgery.
Absolutely,
And the
absolutely.
apprehension is too high.
Right.
Yeah?
So
You
most
do
of the
feel
patients
that.
are quite young and healthy.
Yeah.
So they haven't undergone any kind of surgery before. Most of them, it's the first treatment in a hospital, surgical treatment.
What have they asked you, which you feel is completely a myth?
They said that it's going to be very painful, or we have to be put to sleep, to be under anesthesia for the treatment to happen. It doesn't happen so. And we do it in topical anesthesia with just eye drops that numbs the eye. Patient doesn't have any pain. Maximum they feel is a bit of pressure when we are making the flap, but otherwise there's no pain as such. And
have you come across patients saying that, do you do both eyes at once, or is it one?
Yeah.
Or can I go ahead with just one eye?
Right.
Have you come across
we
that?
have, definitely.
Yeah. That is also connected to an apprehension, or do you feel that they do have some kind of, lot of parents say कि एक आँख पे पहले छुओ, दूसरे पे मत करो, that kind of thoughts also come around.
Right. And they, many of them have seen their parents undergoing cataract surgery, so they feel that it has to be one eye at a time, and both can't be taken at once. But definitely it's quite safe procedure. Both eyes can be done in the same sitting. And pain is one that which is more worried about by the patients.
And what are the true facts that you want to tell the people, that what is actually there?
Look, it's totally painless procedure. All right, both eyes can be done on the same sitting. It is done on the same sitting most of the time. Recovery is very easy and straightforward. It's not a big procedure. You have to get admitted overnight in a hospital and have to undergo anesthesia. But no, don't worry about it.
There's another myth which of course, it's a view from the patient.
Right.
After surgery, we can't see bright light.
Oh, okay.
Have you come across that?
Yeah. Some people say we have to be in a dark room for a week, or sometimes I've seen people being in dark room for a month. So there was one patient who ended up, spending 1 month in a dark room after surgery.
That's
that was when we didn't ask him to.
Yeah,
he was told by his neighbors and some friends that he had to be in a dark room. So
and how did you get to know after he came back?
He came back to us and then he said, we haven't joined the work and I've not been outside my room for this much time and I've switched off all the lights. So no, it's not required. You can go out in the sunlight. There's a procedure, a laser procedure called PRK, after which patients have a bit of photophobia or aversion to light. So in that case, definitely for a week or 10 days, the patients may feel the lights are too bright or painful to their eye. So in that case, definitely they can stay in a room. And,
of course, that is for a particular group of patients. It's
right.
not
It's not all the LASIK patients, but those
Very
patients who have undergone PRK, and that too, not all of the PRK patients are playing the same.
They don't. There's another myth which I have come across. Patients say that we cannot wash our face and we cannot take a bath for 2-3 weeks, and that is another thing which I'd like you to discuss on. It's very common.
So in LASIK, there's a flap in which takes some time to heal completely, right? So we don't want any kind of infection to be introduced into the eye. So they can have a normal bath from neck down. When it comes to face, we advise them wash their face with eyes open. Avoid head bath for a week. And then after a week, they can resume their head bath, but when the water crosses their eye, they can close their eye and let the water pass.
What about sports? Have they all asked you that? That fact that can they play sports? Can they go swimming?
Right.
That's an important point which the patient should know, that this is a fact.
Right.
So what do you feel with that?
Yeah, sports-wise, I don't refrain them from playing sports for a long period of time, but a week I give them before they go back to running or any kind of field sports. And
what about gym? Have you been?
Gym, I tell them that not to pull up heavy weights for a month after surgery. So again, the cornea is weaker, it's thinner than their usual, and if they pull up heavy weights, they're going to increase the eye pressure again till the cornea forward. So no heavy weights, they can resume normal exercises without lifting weights for a month, and then after that they can resume slowly.
So I hope there's been good clarity of the discussion we just had, and very valid points have come around that it's a myth. You don't really have to be in the room for so long post the surgery. You do not have to, not take a bath. You can take a bath head down. You can resume your normal day work even the very next day if you're comfortable. The only myth I feel is very, very pertaining and important to remove is the fact that we'll not be able to see clearly. That also people feel. These kind of myths I think can be removed. The fact remains that it's a very stable kind of a procedure. The stability we've already discussed, and also that the safety net depends upon age profile and the profession. And of course, gymming should be kept only to avoid any kind of heavy weights, and you can swim, you can work, you can do everything, so it's absolutely safe.